Hello and welcome to this special public policy series. I'm joined by Dr. Shubnum Singh, CEO of the Mac Institute of Health Education and Research. Thank you very much for joining us. So there are many challenges that India faces in the healthcare space. One, I'm assuming, is the very changing profile of disease. Life expectancy is increasing. There are new diseases that are cropping up. There is a more fundamental problem of delivering healthcare. But you've identified outcome as an important issue, and the fact that patients need to be far more aware of the challenges or the medical challenges they're facing in order to even maybe solve them or resolve them before they actually reach the door of the hospital.
Absolutely. Actually, healthcare starts with you as an individual, or I as me, So you have to look at it as to how do you empower a person to know his or her responsibility as far as health is concerned. So if you look at the spend in healthcare, typically it is done today, 75% or 80% of what you spend on healthcare is in the last 1 week of one's life. And because you're spending that kind of money right at the end, you really don't look at it proactively. It's filled with and fraught with negative emotions, so you don't want to go to a place which is not happy. That is the way everybody looks at it. So unless you empower a person, and to empower a person, you have to give them evidence to empower them. Right? So if I'm going to not eat sweets today, then the likelihood of me turning a diabetic at a later point in time it won't happen. But if you don't show me data around it, then I'm not going to inculcate that preventive behavior in my life now. So outcomes are very, very important for people to take control and charge of their decisions or their lives. So if you look at it very typically, when anybody had a medical problem in the house, you'd have a family physician whom you've trusted for so long, and he says you need to get a surgery done. You'll ask, who do I go to? Then he in turn refers you to somebody. You'll call up somebody in the family or your extended friends circle and say, have you heard of so and so? Other names will come, and that's the way you do the cross reference. But if you this is anecdotal as best, a very personal driven decision. If you were to translate it and have a rating system based upon the outcomes of a particular hospital or the outcomes of a particular doctor, which is now gradually gaining credence as far as the Western world is concerned, then people will be able to take informed decisions, and thereby both the provider of a service as well as the buyer of a service can take a judicious decision. On the other hand, you have this burst of information which is coming through Google. There was a very nice mug the other day that I saw, and it had this little piece saying on it that, I, that is the doctor, holds the degree, so please give some credence to my practice rather than coming to me as Dr. Google. So you do have that piece also invading when actually you've not walked the mile of being able to have any data or sense around outcomes.
Right. So, I mean, data is clearly one very, very critical public policy tool, and since we are talking about public policy, and you were telling me earlier that, you're finding that one of the allergies that is common in India, as you found in your mapping, is onions and bananas.
That's true.
And we are all aware, I guess many of us who have relatives in the US, about children having peanut allergies, but many of us perhaps didn't know this one. So how do we spread this message?
So spreading the message actually and penetrating the environment, I think the most powerful tool is through children. It is through children. You have to empower them with some basic knowledge to be able to ask the right questions, and that will be that through their schooling and at an appropriate stage. And I think it's highly relevant in today's day and age when you hear of a 15-year-old having delivered in a bathroom of a school, that you teach them health education, right? So earlier you used to have things, different subjects, include health education, which empowers them, teaches them to ask the right questions, as well as introduces them to the world of data in healthcare. Not that somebody's aunt is my family physician and somebody's uncle, and that anecdotal thing will move. There is absolutely no doubt that you've got to have 100% trust in a particular person, and that comes from a relationship. But I believe this kind of knowledge will further empower and make that platform for trust to develop.
Right. So you're saying start at schools and
Yes.
And also
Schools, universities also. So let me give you an example. For instance, in Delhi University today we have been asked to provide some skilling courses in the university, and the two subjects that have been taken are diet assistant and diabetes educator. Now just see how impactful it will be. These are young adults who are doing their normal course, maybe it's finance, economics, history, literature, whatever you have, and in their spare time they are over 3 years going to get skill certificates. They could even become a diet assistant or become a diabetes educator, but then they get to know everything about prevention. They're able to take care of people in their homes, so they are far more likely to take the right decisions as far as their individual care is, as well as the family's care.
right. So then we come to the issue of capacity building, right? So how do you scale this up? I mean, this is an interesting example from Delhi University. How does this, among other challenges, including, let's say, reaching the right amount of data, you don't want to send too much data, you want to send data in the right form so people assimilate it. How does one
So I'll share a very, very
yeah.
interesting program. This program started somewhere in the late 2013, beginning of 14, and now it's carrying a lot of momentum across the country. We all keep talking about the demographic dividend at the bottom of the pyramid and the impact of not having them skilled, etc. So very, very interesting program started out in Himachal, and we were fortunate enough to be at the right place and be involved in that. Children from standard 9 to 12, they are given the option to take a skilling course either in retail, IT, health, and I forget the fourth one. So through the last 3 years of their schooling, they're doing their regular schooling and they will graduate with their school leaving certificate, but they will also get a skilling certificate which entitles them to get a job. So whether it's in the retail or IT sector. So here you've brought them into the fold. You are giving them an employability certificate along with a school leaving certificate, as well as introducing what are the options in the healthcare space. So it's not just doctors and nurses. For every one doctor, you have 20 other people in a hospital who are absolutely essential for the doctor to maximize his potential. So you have a billing clerk, for instance, in the hospital. You have a front duty assistant. You have in larger hospitals housekeeping. You have IT medical record technicians. In a pure clinical setting, you have OT technicians, anesthetic technicians. There's so many job roles which children don't know about. But by bringing them through this path, you are exposing them to it, you're exposing them to good healthy behavior, and not only that, you're influencing the community. Look at the ripple effect in society out of this.
Right. So last question. So if you were to define the 1 or 2 areas that we should move as a country much faster, what would they be, and how would we direct our energies for, let's say, more transformational impact?
So I would say we have to focus on primary health care. You just cannot let it go the way it is today. And we should just stop saying that we are not spending enough of money on healthcare. So if you were to look at the averages, absolutely rightly so, the public spending has been drastically cut. But if you average it out, the average GDP is close to 6%, which is not bad at all. Most countries do spend that kind of money. Everybody is not crazy like the US, which is spending at 17. So the spend is there. The issue is it being spent wisely? Right? So there has to be some kind of segregation, realignment, restructuring of where this money is being spent. That is one part. The second part is, I strongly believe that whatever infrastructure that we have today has not been optimized. It has not been optimized. So you don't have to suddenly say you've got to build things. You have to see, have you been able to utilize the existing capacity to its maximum operational efficiency?
And you mean this even in sort of smaller towns and villages and so on?
Absolutely.
Okay, tier 2.
You don't have to create spaces. You have to go back and see what are the spaces that are already there. How can you maximize that? and work from. For instance, if you have a dispensary, why should a dispensary shut at by 2 o'clock? Why can it not be open till 8 in the evening and take care of people? It's simple things like that that can be re-looked at. We clearly need to re-look at how do you staff primary care and who is the deliverer of primary care. The ASHAs have done a fantastic job at the ground level, but you've not empowered them. At the best, she's a facilitator of services and she provides information on preventive care. You've got to empower her to deliver some level of care, and that comes to a very fundamental point. Why have we put a ceiling as to the care that our nurses can give? In some bits we have empowered her, but we've not given her legal sanction. Now, legal sanction is very, very important as far as healthcare is concerned, because there's a difference between getting a certificate, right, and getting a license. When you give somebody a license, then you are legally safe. Yeah, you're empowered by the law of the land to provide a particular service. So we've got to see how do we license nurses to do more of care, rather than restrict the level of care, bring in the concepts of nurse practitioners, physician assistants, and then you'll see how the primary care piece moves, not only in rural India, but everywhere.
Right.
Everywhere it will move.
So let me ask you a last question. So, let's say you were the policymaker. Now, as a doctor, if I were to ask you, who's your customer, as they say in business, right? So you say, okay, my customer is the patient, and everything I do is finally because the patient exists, or so on. What should it be? I mean, who should the policymaker or the policymakers think of when they design policy, when they design interventions and so on? I mean, somehow one gets a sense that it's not everyone is on the same page.
Yeah, because for the primary reason, exactly what you said, that you look at the customer as only the patient, right? But you forget the environment. You forget the environment in which the patient is. And when you look at the environment of the patient that is there, you will see all these moving parts. So it's the patient. The patient is suffering from communicable diseases. All the policies will be written about communicable disease. Haath aise dho, make sure this is right. No word on sanitation, no word of overuse of pesticide, nothing. That is left for somebody else. No, this is all integrated. If you have a spate of diarrhea, do you pick up and berate the public sector, the public utility services for it? No, not at all, right? If you have insecticides and you have pesticides on food, anybody saying anything about it? Not at all. So it is an integrated thing at the end of the day that will make things happen. And the policy has to move away from the current piece that is addressing communicable pieces. It has to now include non-communicable. So non-communicable will be like you have the things that you have on cigarette packets, on lifestyle. So it has to be across. It just cannot be the way it is being done today.
Right, that's a good note to end on. Thank you so much.